Hello, my name is Donna Ockenden. I'm the chair of the Independent Review of Maternity Services at Shrewsbury and Telford Hospitals NHS Trust. I hope that all of you have had a happy summer and managed to enjoy the holiday season, and that your families are keeping safe and well as we enjoy our new freedoms. September has begun and schools have already started to resume for the autumn term. We know that as normality returns, we still need to remain cautious. All our lives have changed and we're still having to work and live differently from how we did before COVID-19. My message to you today is to update you on the review, the dates of the family meetings, events taking place with a maternity focus, as well as updates on maternity improvements across England, progress on local actions for learning and immediate and essential actions, and a forthcoming maternity programme on the BBC by the Panorama team. Family meetings. As always, your family voices and experiences are essential and are absolutely central to the review. When the lockdown restrictions were lifted earlier this year in May, we were able to resume our in-person meetings with families in Shrewsbury. We will also be having more in-person family meetings this September and November, as these meetings provide a good opportunity to meet with some of you face-to-face. I will be in Shrewsbury from Monday the 13th of September to Wednesday the 15th of September to meet with families. We will be in contact with those of you that we need to speak with. However, if you have information that you would like to share with us about your case or have any questions, please email us at maternityreview@donnaockenden.com. We can always arrange for you to speak to a senior midwife if you would like to. Events taking place with the maternity focus. Since we last spoke, and in the last month, there are and will be a number of events with a focus on improving safety in maternity services across England. The review team will be contributing to these events as they follow on from the immediate and essential actions outlined in our first report last December. The events are focused on the changes that are needed in maternity services to ensure that all women receive high quality and safe care throughout their pregnancy and birth. Here is a quick overview of these events. The Independent's newspaper special webinar on maternity services. On Wednesday the 11th of August, I spoke as part of a panel for the Independent newspaper's special webinar. This panel was chaired by Sean Linton, a well-known journalist. The other panellists included Dr. Eddie Morris, President of the Royal College of Obstetricians and Gynecologists, and James Titcombe, a patient safety campaigner and bereaved father. The event focused on what has happened in maternity services and what needs to change so the whole maternity system can work to improve safety for mothers, their babies and families. You can see the article in The Independent and a recording of the webinar on the Donna Ockenden website. The link will take you to an article where you can register to watch the webinar free of charge. We also included a link to the webinar in our recent letter to you. Baby Lifeline's Maternity Safety Conference 2021. Earlier this year, I had the honour of being appointed President of Baby Lifeline, one of the UK's leading maternity charities. For the last 40 years, Baby Lifeline has worked tirelessly to make maternity services safer in the UK, through its extensive research, its training of healthcare professionals, and its funding of life-saving equipment in maternity units. Baby Lifeline are holding their second annual conference on Thursday the 9th of September. As President, I've been asked to attend, along with other maternity professionals, subject specialists and patients and families, to present the latest evidence on the safety of maternity care today. The conference will also look at a number of topics, including the learning from the Health and Social Care Committee Maternity Inquiry, which the review team contributed to, as well as how women and family-centred care can be adopted by all NHS trusts. Examples of positive improvement and best practice will be shared, and it will be an opportunity to hear from senior leaders about what the next steps in the National Maternity Safety Programme will be. Health Service Journal Patient Safety Conference. On Monday 20th September, I'll be attending the HSJ Patient Safety Conference. I will be part of a panel which will look at actioning recommendations from the Ockenden report. Alongside Derek Richford, patient representative and grandfather of baby Harry, who died shortly after birth in East Kent Maternity Services, and Sarah Jane Mars, Chair NHS England Maternity Transformation Programme and Chief Executive of Birmingham Women and Children's NHS Trust, we will be hearing directly from patient representatives about the impact of harm from pregnancy experiences, understanding the relevance of your first independent maternity review report to wider maternity safety issues, establishing what further actions must be taken to implement changes in practice and ensure they are translated into safer maternity care across England. These events and discussions are crucial in helping to ensure that NHS leaders gain awareness of maternity issues and members of the wider maternity team continue to learn and receive the right training and investment to deliver an improved future for maternity care. Carry Their Names. Carry Their Names is a campaign created by Mama Academy, which has been working to help save babies' lives for almost 10 years. Mama Academy works to empower maternity professionals and inform expectant parents about stillbirth prevention methods to help more babies arrive safely. I am a patron of Mama Academy and support them in their work to improve the safety of maternity services. Their hashtag Carry Their Names is a campaign raising awareness about baby loss to allow bereaved parents the opportunity to say and carry their babies' names, whilst at the same time raising funds to continually improve maternity safety. During this campaign, I will be linking in with the first family I supported through the loss of their baby 29 years ago when I was a newly qualified midwife. They now live in Australia, so COVID permitting, they will be carrying their baby Gina's name with them to all kinds of locations across Australia and linking in with Mama Academy and me through Carry Their Names. I believe this is a very worthwhile cause to support and will be working alongside Mama Academy to raise awareness of the campaign, which concludes with Baby Loss Awareness Week that runs from 9th to 15th of October. If you would like to find out more, please visit www.mamaacademy.org.uk or contact me. Progress on the immediate and essential actions outlined in your first report. Our team continues to hear about the work of trusts and hospitals across the country who are implementing the immediate and essential actions outlined in your first report. The most recent examples include Wye Valley NHS Trust as well as University Hospitals Dorset. I will now show you the Wye Valley NHS Trust infographic that they developed to show how they are implementing the immediate and essential actions from your first report. The infographic is another example of the excellent work being done around the country in response to Report 1. The Shrewsbury and Telford NHS Hospital Trust Ockenden Assurance Committee continues to meet monthly and reports to the Trust Board of Directors to update on their progress with the 27 local actions for learning and 7 immediate and essential actions. The next meeting date is Thursday 23rd of September, 9 till 11:30. If you would like to attend the meeting, please be aware that the live stream will begin at 9 a.m. and the link for the meeting can be found on the Trust's website nearer the time. Panorama. You may be aware that the BBC Panorama team are in the process of putting together a programme looking at maternity services at the Shrewsbury and Telford NHS Trust and will explore the themes highlighted in the first report of the Independent Maternity Review, which was published last year. We have been informed that the programme is very much based on the concerns and issues raised by families and information contained in our first report. I know that some families have also been contacted by the Panorama programme, and after a lot of thought, I've made the decision to take part in it. My involvement in the programme is to ensure that it accurately portrays the size and scale of the review, 1,862 family cases in total, and as you will all be aware, the human cost of the tragic events that happened. We will be discussing what the 27 local actions for learning and immediate and essential actions mean for improving maternity services across England. As always, the care we have for families' accounts and the anonymity of them will be maintained. We will not provide details or discuss individual family cases with Panorama, even if these are documented in the first report or elsewhere. We will not be sharing any information outside of what has already been published in the first report. We will keep you updated as to when the programme is due to be broadcast once we are made aware. Support for families. I'm keen to ensure that all families involved in the maternity review receive all the help and support available. A number of you have taken the opportunity to use the specialist psychological service that is provided via the Midlands Partnership NHS Foundation Trust. Please let us know if you would like support for yourself or your family. This small team of psychologists are experts in working with individuals and families who've been impacted by the distress and trauma of their maternity experiences. I really do want to encourage you to reach out if you are a family that would like support. There are also a range of charities that can provide help and advice. I have provided their contact details on my website at donnaockenden.com/support for families. Please don't forget you can also contact the maternity review team during office hours 8 till 4 p.m, Monday to Friday on 01243 786 993 or via support@donnaockenden.com or maternityreview@donnaockenden.com. Thank you for taking the time to listen to my update. Do remember that any updates about the review that I make will be made using our usual channels, such as this bi-monthly update, emails, face-to-face meetings, telephone calls with you, and on donnaockenden.com or via ockendenmaternityreview.org.uk. I will publish another update in early November in about 8 weeks' time. Thank you.